Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of A Common Sense MD. You may notice I look a little different today. I have a towel wrapped around my neck. And no, I'm not trying to emulate John Thompson, who used to coach the Georgetown Hoyas. He sweated a lot and he had a towel always wrapped around his neck. That's not the reason I'm doing this. I'm going to use this as a demonstration for you in a minute, because what I'm going to talk about today is very important to you as you age. And I'm talking about neck posture. You know, being a longevity doctor, I notice a lot of things. I notice the way people look. I talked to you a few podcasts ago about sitting in the back of a church and seeing how many men had bald spots in the back of their head. And I talked about preventing that and regrowing your hair. Well, one other thing that I really notice a lot with people, especially as I get older, is forward neck posture. I'm talking about your neck. And how many older people do you see that have their neck craned forward as they walk, then their hands clasped behind them to kind of counterbalance that forward posture that can be very dangerous? It can lead to falls, and it just looks terrible, and it really sets the tone for the rest of your spine. Really, when talk to any chiropractor, it all starts with your cervical spine, and that's your neck. The reason I really got interested in it is because I was looking at new forms of exercise. At 70 years old, I don't do the things that I used to do. And I started to notice in my friends that they started to have a forward neck posture. And I'm sure I have it too. So I started looking up different forms of exercises. So I looked up Tai Chi. And when I was looking at some of the videos on that, I came across a Japanese gentleman who was talking about neck posture. So a lot of this, of course, came from him, but I don't even remember his name. But this is very practical, easy, common sense stuff you can do that yet not many people are probably doing. So anyway, it's very important for your health to have a straight neck. Imagine yourself walking and balancing something on the top of your head. You want everything lined up like it was a plumb line. You want the top of your head really in sync with your hips and your feet. And yet most of us don't have that. And it's interesting the way he put it, because that forward head and neck posture tells your life story. And that's what I liked about it. When he said that, that really resonated with me, that your posture tells your story. And a lot of times it's not only mechanical. We do tend to do things with the front half of our body and ignore the back half of our body, even when we work out. But one of the worst things you can do is work for a living sitting and stooping over people. Dentists have a horrible occupation for that. I've talked to many of them about it, and their neck hurts. But in any event, your neck posture tells your story. And it's a story of caring, empathy, leaning forward, listening to people, helping people, not only working on your computer. So it's a story of empathy and caring, hearing, listening. But unfortunately, it's detrimental to your health. So I want to give you some practical tips. This is a short podcast, but I think it's a very important one, because there's a few things you can do with 5 minutes daily, once or twice a day, that can really help you. I've been doing these because I have a really stiff neck. Thank goodness there are backup cameras in your car. Otherwise, you're going to be turning, your whole body's moving. So you need to really work on this, because your vertebrae are meant to rotate and to bend and to move. When you don't do that, They get stiff with aging. There's no doubt about it. So in any event, I want to show you some practical things you can do before I use the towel. The first thing you need to do is flex and extend. And I want you to remember, as you do these movements, I want you to go slow. They're not hard, they're easy. And I want you to breathe, because if you're not breathing along with it, you're not doing it right. So it teaches, by breathing, it teaches you to relax, and it's a neurologic thing. And it's also a psychological thing, believe it or not. It's all integrated. So I want you to flex your neck forward. I want you to bend it back. Flex. Extend. These are just movements. They're not really stretches. The other thing I want you to do is to rotate to the left and to the right. Slowly and hold it. The other thing I want you to do is do some side bends, like you're curious. I've seen my dog do this one. That's a side bend. Now, for a very important one, we talk about retraction and like moving your head back and forward. I don't like that. I think the easiest way to do it, and this guy demonstrated this, is to do it this way with a towel. So you're going to take the towel behind your head and pull on it. That makes it much easier to do the retraction exercise like this. It's really easy. There's another move I want you to do. It requires you to stand up. I want you to stand up and clasp your hands behind your back. What this does, it works on your scapula. You feel like you're pulling your scapula together and pulling your neck back at the same time. I'll demonstrate. Pretend I'm standing. I'm putting my hands, clasping my hands, and retracting my scapula and just pulling my head back. It's really in the scapula. So I'm getting the crown of my head in an upward position. When you walk around or do this, have your head look up. It's almost like you're acting a little cocky. You know, you're putting your nose in the air. You're holding your head high. Don't slump forward like you're shy and you can't be bothered. Hold your head high. That way the crown of your head is even with the rest of your vertebrae. So kind of walk around that way, sit that way, unless you're obviously writing or on your computer. Then take breaks to work on this a couple times a day. Just be aware of it, kind of like you're aware of your core, which is the key to your low back, is tightening everything up. Tighten your abs. Your core is not only your abs, but also your hips and your buttocks, your glutes. So think about doing these simple exercises a couple times a day, especially if you notice that you're getting that forward head bend. So look up, look out, do those exercises. You'll save yourself a lot of grief down the road. And you can also reverse what's happened to you already. You can gain mobility. So remember, your neck posture tells your story. I'll see you guys next week.